Hello, everybody. I would love to just do a quick video and answer your questions. There has been some few people that have actually reached me on my email, mentalhealth.bii@gmail.com. I would not mention your name. I will just post all the questions on the little PowerPoints and just make it quick and right on the point. So let's get started. All right, first question. Someone asked me, why did you take the oregano oil instead of the antibiotics? Like I mentioned in the medication video that I uploaded, just look it up and make sure that you understand all the medications I posted that was prescribed to me for explant surgery. I always say to please make sure to know all the side effects, to understand what the medications you're going to be taking, so you know what you expect from them, right? So basically, the reason why I did not take is because of the side effects of the antibiotics. It made me have a lot of, GI issues, like especially nausea and rashes here and there. Also, is one of the rare side effects. It's one of those things that you just have to know. Is this the right way I want to continue, or you have to find some other way? So, like I tell everybody, if you do take the homeopathic or any herbal supplements on the side, make sure to mention that to your doctor, because that would prevent from any worsened side effects that you may have, or may have any interactions. Because remember, some herbal supplements may either increase or decrease the dosage of depending of the medications that you may be taking. So, just to kind of briefly let you know about that, and knowing about oregano oil, it has a lot of amazing properties, healthy properties like antioxidants. It's such a potent, powerful antioxidant. It has a antifungal, anti-inflammatory, natural antibiotic, which is a great thing to know. It has it actually helps you lower cholesterol, and it helps you, has a lot of properties that helps you to lead you to a healthier gut health, right? So due to its inflammatory, antifungal, antiparasitic, and antibacterial properties. So it's just knowing that fact that it has a lot of different amazing healthy benefits. That's the reason why I end up taking it. But also make sure not to overexceed the amount of taking it, because you think, oh, this is not going to do anything about, oh, everything is going to be okay, blah, blah, blah. So just keep in mind not to overexceed the amount, right? The amount of thinking because it's an herb or because it's a plant. No. It also has some ways to make, hopefully not harm you, but it can lead to that if you're taking it over excessively, right? So I would suggest, like if you're treating this as an antibiotic, usually a 7-10 days period could be a good period to either you start and you end taking them. In my case, I ended up taking it the day I woke up from this surgery, and I took it breakfast, lunch, and dinner, and for 7 days. So I ended up taking it the day of the surgery, obviously not before the surgery, but after, when I woke up from the surgery, until 7 days. The day that I ended up taking the JP drain, I actually ended up, they took my drains out on the 7th day post-op. So just keep that in mind. Like I said, this is the way I did it. Not to mean like you have to follow the same way, but I'm just kind of educating it to you. So remember, breakfast, lunch, and dinner, one sub gel capsule, and that's what I did, and it really did good for me. So let's continue. All right, the next question. Why did you not take any of the prescribed medications for explant? Look, like I mentioned, I was given prescriptions to pick up at the pharmacy 1 to 2 days before pre-op. So like I said, all plastic surgeons are different, so you just have to follow their instructions. I was given prescription antibiotics, maxillary relaxant, anti-nausea, Aprepitant, Percocet, and those are the medications that were prescribed. Over-the-counter Tylenol, you can pick it up either CVS or Walgreens, any NSAIDs for pain. So you're wondering, why didn't I take them? So knowing myself that I'm quite sensitive for medications, I just still went to the pharmacy, picked them up just in case to have them on the side. Ask me why. This is the way I did it. Doesn't mean you have to follow what I did, but I'm explaining my story. So knowing that I've had all these side effects from antibiotics, I did, like I said, substituted with oregano oil capsules. And the muscle relaxant, I did end up having muscle spasms, but believe it or not, I was able to tolerate them. So I did not I didn't have that need to have them, right? Believe it or not, I actually ended up having nausea when I put these implants in. I remember from anesthesia, I had them on the side, especially this one too, because they ask you to have this one to take the Perpiten an hour early before the surgery. So I did not take any of them. I did not have no nausea, and I'm really grateful for that. Percocet, that's for moderate and severe pain. I did not even have a moderate and severe pain. I was actually able to control. I would probably say I had mild to some days moderate, but it was very tolerable. It was something that I was able to tolerate. And Tylenol, I was never taking it. So I did not take any of these. So like I said, you're the one that's going to decide ultimately which medications you're going to take or not take, or just go a different route. It's okay. As long as you tell the doctors of whoever's prescribing you medications for your medical conditions, make sure to mention that if you're taking the herbal route or homeopathic route, so that way they know. Because remember, that will make the other medications either increase or decrease the dosage. It could be really toxic to your body. So just kind of keep that in mind. Next question. What did you take instead of prescribed medications? Like I mentioned, I did do my own research. I know my body how it reacts to medications. I substituted the antibiotics with the oregano oil soft gels. And this is a link from my Pinterest. So this is the link of the Pinterest for oregano oil. So you can easily just click on that and find it that way. I have in the Pinterest, I actually have all the things I use for EXPLANT. I put also for nursing, I put things for psych nurse practitioners, books that you need to look out for, and things that you must, it's like a must. I'm putting things up there that I actually personally use, and I do my personal review. So that's something that you can look it up and either get it or not get it. It's just like an idea for you to kind of help you, guide you through this process of EXPLANT, through nursing school, through psych nurse practitioner school. There's just many other things I posted there too. So just kind of like an overview of things that I have done. All right, so like I said, no medications I've taken. I didn't take no nerve block or no banana bag. Those are the two things that they're extra service and extra out of the pocket. Basically, you pay aside from your payment from your surgery. So I did not take any of them. So basically, what did I do instead? I was able to control my personal pain. Like pain is a subjective, right? It comes personal. It's a personal number from a 0 to 10. Like it's actually pain is considered as a fifth vital sign, right? It's something that is must asked as the time that you are seeing a doctor, right? So it's a definitely I was able to tolerate. I was able to manage it, and I'll let you know how. So what do you do to control your pain? That's something that I have done. I'm the type of person that have rarely taken any medications in my life. I pretty much just I've eaten healthy, even though it is incredible how you stop and think, right? One of the things I have experienced was a lot of inflammation while I had these breast implants. And I have noticed that I have gained so much weight over all this inflammation, over all these extra pounds. And all this, at the end of the day, I have noticed today's my 7-week, 1-day post-op, and I have noticed all that inflammation, quote, extra weight gain was just inflammation. So it's incredible how your body reacts after this bags comes out of you, and you just feel like you just have taken all this extra weight off of you, all this inflammation. So it's just incredible. It makes you appreciate your body even more. So what I have done is the non-pharmacological way, which I have not taken no medications. You may think, oh, this is just so basic. This is anybody can just do this. And okay, so I have, how can I say, I have able to master, maybe I would say at this point in my life. It has been my own personal way of managing my pain over time. I mean, obviously there's certain pains like a toothache or maybe a menstrual cramp. You may take something to relieve your pain. Maybe there's some times where I have to take something because, you either have to go to school, you have to do work. I can understand that. And I'm not saying I've never taken medications. I have taken it. It's just there's sometimes you just have to really think, do you really need it, right? Not because a doctor may prescribe to you, you have to take it. No, it's all ultimately your decision. So, like I said, my pain is tolerable. So I have done a lot of deep breathing, a lot of body movement. But you say, oh, body movement, but you just have you've taken these breast implants out, so you're probably very sore. Yes, you're gonna be very sore, and you're gonna be really tight as far as on your surgical sides, like the armpit area, the upper breast side is going to be really feeling like tight, like muscle tightness. So yeah, you're going to feel that. But in the same time, you remember, you have to move the body. You have to keep moving the body. Because if you're going to have this dinosaur arms, like they say, oh, I feel like I cannot move my arms. No, no, no. I understand the first 24 hours are the most sensitive part of any surgeries. And I do understand that you have to be conscious of not moving your bodies too drastically to you know, you're just not going to bend down on picking up something. You're not going to just extend your arm all of a sudden. You have to keep in mind you cannot move those arms the first 24 hours because your incisions are really fresh, right? And you don't want them to open. So you have to super be careful on the movement. I noticed and I've heard women having the nerve block, right? And that pretty much helps to manage your pain. And it lasts usually 2 to 3 days. And what I've heard, I have never taken that, but I do notice that, oh yeah, I've gone here, I've gone there, I've visited my grandma, I went to dinner, and perfect. If you have an agenda, okay, but you have to be conscious of your movement. You have to be conscious that you just got out of surgery. So my ultimate opinion, just because I've been around this field for several years, so I know about this area, please, I would just take a time out the first 24 hours and just relax. You can walk, definitely, like walking in the house, like walking maybe on the sidewalk outside, or, you know, obviously not make sure not the sun to hit you or anything like that, but just very light, but definitely walk. Yes. Your arms can still move it. I still was able to do arm curls, obviously with no weights, from the first day. Believe it or not, from the first day, I ended up doing that. Very, very, light movement. And be conscious of now lifting your arms all the way up past your shoulders. You just don't do that. And I'll let you know down the road. Just be careful of those surgical incisions because they're fresh, right? They can easily just open and you're going to get infected and it's going to lead to a lot of problems. So anyways, so yeah, first 24 hours, make sure to take just a break and let your body just heal. You can walk, no problem. Have light walking at first and then increase your pace as you go. I did a lot of praying, a lot of meditation. I'm a very spiritual person. I always have this connection with God, and I just do whatever ways that makes you really have the spiritual side really aligned. Listen to music, any calming music, anything that makes you happy. Just calm down, relax, put your head back. Obviously, just do it a proper way. At first, in the first couple of days of surgery, I would say first, I make sure to be on the 35-degree or 45-degree head of the bed, as far as putting your pillows up and stuff like that. That way you can easily breathe and not able to hurt your surgical sites. That's what I did. Make sure to hydrate. Super, super important. People are like, oh, I don't like water. No problem. There's a fix to that. I usually put my water with slices of cucumber, which has a lot more hydration on top of that. And it has a lot of water content in cucumbers. I put like slices of lemon to make it more alkaline in your system. So it's just ways to just kind of like make sure to drink the water. I'm going to tell you something. Water is very important. Your body needs that water, that hydration, not just for like just to make you feel to be able to regulate your blood pressure or anything, but it's good for your joints. It's good for your body, period, your healing process. So just as basically little points here and there is, like I said, all these things I tell you is not really like one size fits all kind of thing. It's not like it's just going to be exactly like this. but this is my way of telling you, this is kind of the way of what happened to me and my journey. So you will definitely feel, I felt like moderate tightness upper the breast area, and ended around the 5-week mark. There's like a slight tight, feeling a little slight tightness by the side of the breast and armpits. Today's my 7-week 1 day, so I still feel a little bit, not much. Soreness on the breast fold and surgical incisions, and pain 2 to 3 level out of 0 to 10, numeric scale up to 5.5 weeks. So that's just my personal experience. Actually, I was able to tolerate. I never had severe pain whatsoever or severe soreness. I did get maximum like moderate. But just be careful also. I noticed within the first week, once you have the drains, or I would say first 2 weeks, when you're in the car and somebody's driving and you feel super sore, that's what I felt. And it's very, very uncomfortable. That's the one experience I get. Arms movement past shoulders by week 4.5, I would say. Also keep in mind, all the surgeons may give you like like a package, like a pamphlet, like an outline, things that you're going to look out for each week. This just to give you more than an idea. Okay, I hope everybody hear me. This is just an idea how everybody pretty much heals, right? So it's not like it's exactly the way it's going to happen to you. So I'm going to be honest, I have read the first couple weeks that was there, and I just kind of, knowing me being, a nurse and being in the healthcare field, everyone heals differently. So ultimately you're going to have to hear your body, how it reacts. If you're in pain, you're not going to keep doing the certain thing that it keeps you having this pain. So you're going to stop, I hope, right? So just keep in mind. So yeah, you're able to move the arms past your shoulders, like literally raise them up with no problem. Like right now, I'm raising up my arms with no problem. Like I said, I still have a little tightness on my armpit area, which is no problem. It's normal. My surgical incisions are fantastically healing. I will definitely post a video coming up. Look out for them on how to massage your surgical incisions. And like I said, in my Pinterest, you'll find the products that I've used for the surgical incision massaging. I have not bought anything fancy. Just I will let you know down the road what I've done exactly. At week 7 and 1 day post-op today, I'm feeling incredibly wonderful. I would say about 90-95% of all the BII symptoms are poof, disappeared. So I am super grateful. I'm super thankful. It's just really unfortunate. I came across some videos from doctors. I'm not mentioning any names or anything like that. It's just they have their own opinion on certain things. They have an opinion on different topics, especially on this one, BI, breast implant illness. It's no problem. This is what they feel. They say it's not really 100% what the cause may be, or it's just they just simply may not have the enough knowledge on the area, as far as, because you have to be on the other side to understand. And I'm not saying they're wrong. It's just the way they based on their videos on based on evidence-based, which is amazing, which is 100% great. But there's always another side of that. I'm all about evidence-based. I'm all about researching. I'm about educating. I'm all about that. But at the end of the day, it's also plus. So you have to put a plus there. It's also plus the experience of your own experience with BI symptoms, period. Now that I have been through this route, now that I have been through all this suffering, now that I have been this dark cloud, I call it, girls, you are not alone, and all these symptoms are not in your head. I will always suggest to take all the capsules out. Most surgeons, or most doctors that I came across, which I said is their own opinion of how they come out in videos, and they say, yeah, you don't necessarily need to take them out. I do not agree with them, but that's just their own research. Well, this is my research plus. Remember, the plus is different. It's a different ball game here. The plus is because I was on the other side, and definitely I'm not going to mess with any more with my own health. I've been through this ride. It was my own choice, and I do get it. Now we all here to make it right? So you're going to have to do your own research on what other areas you want to take, either take that capsule or not. I'm going to make a video on this to be more clear on what I'm trying to talk to you about. So yeah, let's continue. All right, so any more questions you may have, there's a different lines here. You're like, oh girl, you're social media crazy. Not really. You got to understand, you may think there's a lot going on here on this page, but like, I've never been on social media. I've never really contacted with any of you like this. I guess I found this late. I love educating. I love to bring some kind of guidance in something. I love to just, I have such a passion on human beings, period. No matter what history you may have, no matter what you tell me that may sound this and that, I'm not here to judge. I am very open-minded. I'm very able to kind of help you, to guide you in any way, you know. So here on Pinterest, you'll find anything in regards to EXPLANT, nursing essentials, psych nurse practitioner books, actually more on books that it's like a must, for example, for nursing, for psych, things that you just narrow down to the books, because in schools are going to give you lists of different things to buy, and from my own opinion, don't waste your money. On EXPLANT, it's just narrowed down on things that I have personally used, and also of what I've heard from women that have used, but mainly what I've used, and just to kind of more or less give you an idea, right? So yeah, YouTube is just the same stuff that I have here, maybe different things that I've posted there. IG is basically, this was my very first channel, my first baby. I have women straight from my doctor's group here. You're welcome to be there as well. There's, you know, I just created this TikTok thing, and like I said, you can also, my main suggestion for you all to just write your questions that you may have on my business email. That way I'll keep you private as far as your, you know, your questions. I'm not going to mention your name or anything. So yeah, I think that will be best. If not, if whatever ways that you reach me, you can say, hey, by the way, check your email. I asked you a question or something like that, so I can just look up for him. Just to keep in mind, by the month of September, I'll be a little bit busy, a little bit hectic. I end up getting an amazing opportunity of a job. I will mention that later down the road. But don't worry, do not worry, because I will keep you an eye on you guys. I'm not going anywhere. So you can call me at the end, mama. You can call me auntie. You can call me cuz. You can call me prima. You can call me mama. Whatever ways that you can contact me. I am just your family member type of person. I'm there to help you the best that I can, like I said. And thank you for stopping by to this channel. Have a wonderful day, everybody.